want to give you a little idea about RTI International if you're not familiar with us. RTI International is a large nonprofit research institute based in Research Triangle Park, North Carolina. But we have offices across the U.S. as well as across the world. I think I was surprised by the lack of worry by the majority of people, that they weren't very worried about themselves or their families getting it. And I think that was just that it really hadn't hit very hard here yet. And people were still in their, their normal life, so to speak, and worried about the things you have to do, like feed children at night for dinner and get them to school and, those kind of get to your job. So I think it hadn't fully sunk into some people yet. But again, I might be speculating that people aren't that worried still about it. So we will ask that question again to see if that response has changed, and sort of expect to see that people's knowledge will be at a pretty high level, that we won't see some of the same don't know kind of levels of response, because hopefully people are paying attention, are getting good, accurate information from their news sources or their friends and family, hopefully. And so I would hope to see that, and I would expect that we might. We do have a group at RTI that is investigating social media and some of the patterning that's happening there. And I have to admit, I don't know a ton about it, but this is a good time to plug that RTI has a lot of COVID research going on. And I would encourage you to go to rti.org. There is a button to push about COVID that should lead you to a page that indicates all the different research we're doing, and might show some of that. But I do know that we're doing some social media data mining to understand what might be out there in terms of misinformation, people, and hopefully spread of, fully accurately information as well. The thing that's really important is to think about your end game. What do you want? What question do you want to answer? What is going to be most useful? So if you're working for a client, for example, what do they need to know? And so I indicated that we talked a little bit with CDC about these findings. We were really trying to think about what's helpful to them to understand specifically related to these knowledge gaps, and what could be communicated better or more clearly, so that the population, knows better about what's going on. There will be careers built on this pandemic. There is, years and years and years of research ahead of us to think about. We're in the midst of it right now, right? There's sort of the immediacy of it now. But there will be, sociology studies. There will be, all the different avenues about how this affected our world. How can we prevent something like this in the future? How can we plan better for things like this in the future? All of those kind of things we will be talking about for many, many years. So there's a place for research in all of that. I think it's really important to keep reiterating that to the public so that it sinks in and they really understand why we're doing this. And I think it's a matter of getting it out in different medium, right? So newspapers, social media, television, wherever people might get their information, is try to put it out into those avenues so that people can see it and hear it again. Most of us need to hear things a few times for it to really sink in and understand the information. I would love to know what is motivating people to comply to the mandates. Do they understand that what they're doing does in fact pay off in terms of not getting their grandmother sick, or making sure that the hospitals aren't overloaded and that the first responders and healthcare providers, this slows down the cases for them and helps them do their jobs better. When we are 5 years out from this and we're still talking about these data at a conference, which is most likely to happen, what do we want to know 5 years from now? How will this help us understand an upcoming pandemic, plan for it, better communicate to the public about it, all of those kind of things. So we've been thinking really hard about how these will help us in the future, not just now, but in the future to understand, could we change our public health policy around how we respond to pandemics? Can we do better planning? Can funds be allocated to those kind of things so that we help prevent some of what's happened this time around and make our response better for the future?